So, good morning to our clinical instructor, Mr. Renato Balara. I am Joanne Tomas from BSN 3-2 and I'll be performing the recorded return demonstration for the NG tube removal. So, may I start na po? Okay po, thank you po. So, what we're going to do is that we have to know what is the purpose. So, the purpose is that we have to provide comfort as much as possible to the patient and to prevent any complications. So we have 9 equipment. So that is tissues, the 50 ml syringe. So anything that I will be used will be fully improvised as my equipment is on Cabalutuan and I am currently here on Gimba. So also the tissues, the 50 ml syringe which I will be I'll show it later and it's optional. And then after that we have the non-sterile gloves, the stethoscope, non-sterile gloves, the stethoscope, improvised stethoscope, and then after that we have also the disposable pad. And then after that, we also have the normal saline solution that is optional. And then we also have the MS's basin, and then that is improvised. And then of course we have the disposable bag, which will be assumed later on. And then after that, we have to proceed on our assessment. So for the assessment is that we have to auscultate, or we have to first assess for the abdominal distension of the patient by identifying its firmness simply by first auscultating for the bowel sounds. So ma'am, auscultate pa lang po yung tummy nyo para pakinggan po yung sounds kung normal po pa or hindi. Okay po? Then after that, I'll be just palpating the abdomen. So, ang gagawin ko natin is papalpate ko po yung abdomen nyo to test for the firmness and tenderness. Or if there's any distension. Okay po. Thank you po. So, after that, we will now be proceeding on the after the assessment on I will be assessing also the tube. So according to the tube placement, the amount, consistency, and the color. Okay, so the tube is normal, and then the patient is also normal. There's no distension. There's normal bowel sounds as well as the abdominal firmness. There's no presence of it at all. And then after that, let's proceed to the assessment or for the procedure itself. So we have to check for the medical order. If there's medical order that says there's an NGT insertion removal or NGT removal. So there's an order saying that is to ensure that the physician has the right intervention or right implementation. And then after that, we have to identify first is that we have to perform hand hygiene and wear PPE as indicated. So as we've all known, so assuming that I just wear PPE if indicated, hand washing and PPE are ways used to prevent the spread of microorganisms, and also we've all known that PPE is used based on transmission precaution. So we have to now identify the client and explain the procedure why is it necessary and perform key abdominal assessment. So and explain to the client that they have a discomfort to feel. So a quick discomfort. So good morning po. Ako po si Joanne Tomas, magiging student nurse niyo po ako from 7 a.m. to 2 p.m. po ng hapon. Okay po? So, student nurse po ako sa BSN University of the Philippines. And pwede po bang malaman kung anong pangalan nyo?
Sila.
Then, ano pong birthday po nila?
7 September birthday.
Ilan po ilang taon na po sila?
7 years old.
Okay, and then, After that, we have to explain to the client. So, ma'am, magagawin po natin ngayon is magpa-perform po tayo ng tinatawag na NGT removal. So, tatanggalin na po natin to. Okay po? So, yan lang po muna. So, tatanggalin na po natin yan maya-maya lang. So, ang gagawin po natin is para po mabawasan na din po yung discomfort. Okay po? So, the rationale in identifying the client that ensures the right patient receives the right intervention, as well as the right patient receives the right intervention and reduce the errors. And also the rationale in explaining is explanation increases client's cooperation, as well as the assessment for the abdomen makes it vital before the intervention or the treatment or the procedure itself. And then after that, after we explain, is that what we're going to do is we have to close the curtains assuming that I just close the curtains, I just close the door, that is to provide patient's privacy. And then of course, we have to raise the bed. Okay, so release ko lang po yung bed. Okay po. So you have to raise the bed into our working position or comfortable working position, preferably the level of the elbow of the medical provider, as well as after that we lift the position into 30 to 45 degrees, the head, and elevated the head. And then, of course, that is to prevent back and muscle strain. And then also, what we're gonna do is that we have to drape or cover the chest of the client with disposable pad. So, anay ko lang po ito. And then, so, medyo paupo na po tayo. And then, let us offer the client a messy spacing, and as well we also have to offer tissues. Okay po, may tissues po tayo dito, so pwede niyo pong kuhanin po sa akin kapag gusto niyo na pong mag-blow sa ilong nyo after the NGT removal. And then, after that is the rationale in doing so. So what we do to the client is that we lift the bed into a comfortable working position, and we position the client into 30 to 45 degree position. That is for us to ensure there's no aspiration. And then of course, we offer the client to have a drape or cover the chest of the client with a disposable pad. That is for the client to have prevent gastric secretions, as well as the emesis basin. We offer the emesis basin for if the client vomits or gags. And after that we have the tissue in hand. So if the client blows her nose after the NGT removal. And then after that, after we close the doors, is that we now put on gloves. You have to put on gloves, as well as we have to disconnect the suction to the tube. You have to disconnect the suction to the tube. Okay, we have to disconnect the suction to the tube. Okay. First to turn off the suction, and then disconnect the suction to the tube, and unpin the tube to the client's gown, and then remove the adhesive tape to the client, and then after that, the rationale in doing so is that suction, disconnecting the suction and the tube from the patient would most likely for us to have unrestricted removal. And then after that, we have to, for the syringe, so, it's an improvised syringe, so I'll just be pushing air or pushing water first, about 10 ml, and then after that, I'll be pushing air, about 30 to 50 ml of air, and then I'll just leave that because the rationale for this is to air and normal saline solution rinses and the tube secretion cleans, and also cleans the tube secretions with their feedings and debris. And then after that, we have to, after we put on gloves, that we have to check also the placement of the tube. So we done that, and then we have to clamp. So for the clamping, we have to clamp for the tube, and then after that we clamp for the tube by our fingers, by doubling itself, and then after that we clamp it, and then what we're going to do is that we instruct the patient to have a deep breathing. So deep breathing and hold her breath until we finally remove the NGT. So ma'am, ang gagawin po natin ngayon is pwede po ba tayong huminga ng malalim, tapos pigilan po yung hininga natin habang nire-remove ko po to, habang naalis ko po ito sa inyo. Okay po, hinga po tayo malalim, tapos pigilan po yung hininga, pigilan po, okay po, while the patient is not breathing or holding her breath. So what we're gonna do is that we quickly and carefully remove the NGT. Okay, thank you po. So NGT on the client, and as well we have to coil it and then put it on our disposable band. And then after we do that is that the rationale in doing this is because we clamp because we are preventing the drainage to go to the esophagus as well as the pharynx, and then also we are instruct the patient to have a normal, or we have to hold her breath and deep breath. That is because that the patient for the patient to have to prevent aspiration, and as well as gastric secretions, or aspiration of the gastric secretions. And then after that, we also do is we also after we clamp, we instruct the patient, and then we carefully remove. So we carefully remove, and carefully removing, that is one way to minimize the trauma and discomfort to the patient, as well as we put it on the pad, we coil it and we put the tube on the pad. So that is because to prevent leakage. And then after that is that we have to dispose the tube on, so imagine I have here, so imagine that I have here a disposable bag, and we have to dispose it, and then we have to remove our gloves, and we have to perform hand hygiene. So after we remove our gloves, so of course that prevents us from getting or transmission of microorganisms, and then contamination also, and we are following the biohazard first policy of the institution. And then after that, we have to offer some oral care or oral hygiene to the patient, as well as after we offer is that we have to offer tissues if the client blows after NGT removal. Okay, so gusto niyo po ba na mag-oral hygiene? Okay, so assuming that I just have done oral hygiene, and then gusto niyo po bang tissue para mag-blow po yung nose niyo? Okay po, thank you po. So I'll be disposing also on the disposable bag. And then after that, after we offer, so what we're gonna do is that we have to lower the bed. Okay, so we have to lower the bed. So lower ko lang po yung bed. Okay, and then after that, we have to lower the bed. That promotes, of course, patient's comfort, and we have to remove the equipment. Okay, we have to remove the equipment. That is also, and we lower the bed, we raise the side rails, and then that should provide patient's comfort and safety. And then after that, for the last two, that is, we should put on gloves again, because as we've all known, gloves protect us from bodily fluids, blood and bodily fluids, and prevents the transmission of microorganisms to another, of course, and the contamination. We are preventing here the contamination. And then after we put on gloves is that we will now be measuring the gastric lavage or gastric drainage. So for the gastric drainage is that what we're going to do here, imagine that this is our gastric drainage. So what we're going to do is that we have to measure the amount of gastric drainage. This is because the gastric drainage serves as an output. So we have to record what is the output here. So okay, so we have to record it. So after that, we have to subtract the irrigant fluids as well as add the you have to the solidifying agents. So after that, that is according to the institution policy. And after that, the rationalization in doing this is because irrigants fluids are considered to be intake. So to obtain that true gastric drainage is that we are going to minus or subtract the irrigant fluids to the drainage or the gastric drainage. So Because the gastric drainage is also considered as the output fluid of the patient, as well as solidifying agents are considered safe biohazard disposal. And then after that, we have to remove additional PPE as indicated and perform hand hygiene. As we've all known, hand hygiene and PPE are ways used to prevent the spread of microorganism or transmission of microorganism, as well as the contamination on it. And PPE is used based on transmission precaution. And after that, we have to record and document the procedure. And that's all. Thank you and God